I will say this, if you haven't heard me say on one of my recent calls, I used to be 6 months ago, let's use these and let's get off as fast as we can. Now, with the more, and there's a reason for this, there's more and more literature that I continue to see, more and more advancements in our understanding. I am becoming more comfortable with these medications in terms of they're a lot safer. They're being used for all these other indications, less downside. Not saying no downside. I still think the goal needs to be heading towards less dependence. Now, does less dependence mean we have to completely wean off? I think that would be the most ideal, right? I think everybody in a sense would say if I can maintain health and feel great without the meds, I'll choose that. So I think everybody wants that. What is your long-term goal here? Because there's my goals and then there's your goals, which is the most important.
I know. That's what I wanted to talk. That's why I wanted to come on and talk to you about, because I don't know how to, what do I do? Maintain this now for the rest of, I don't know what to do with that. With that part. I do work out a lot, but consistently. I'm a personal trainer also and a teacher and stuff. So it's not like I don't have that. It's just it is helping me with my, because now I'm moving, which just, I don't know. I just feel like it does help me feel calmer, and then I don't overeat like I was.
Totally. So this is an interesting conversation, and this is great for everybody to learn. It's a little bit different,
It is different.
And I think nobody can give you a super accurate answer because obviously these are newer medications, right? So we're still learning a ton about.
I felt like when I was, so it took a while for some reason this time to get it, but 3 weeks from when I ended with everything. I didn't have anything for a month, and now I'm moving out of state, and I felt very like I was so calm and relaxed. It really took the food noise away and everything, and I felt like I couldn't maintain because I'm a stress eater. So I really wanted, and I felt all the other added benefits of it from stress, from my anxiety. It really helped. I've always had it, and I've never been on any antidepressants or anything. They've never worked for me. And this really helped anxiety and my food, my binge eating and stuff. So I just wanted it to have maintenance with it. And it's at the lowest dose every 2 weeks, but just a little. I don't feel like I even need a lot, just to take me back to being able to maintain and not having that binge and food noise.
Okay, so for you, we're at our goal weight. You've been there for a while, but you're at a point where you feel like you feel significantly better when you're on tirzepatide, right? Is what we're saying. And are you saying you're doing one shot every 2 weeks, or you're doing one shot every week?
One shot every 2 weeks.
And it's 2.25 units.
I did 30.
Okay.
Yeah.
How long have you been at the every other week?
I just went back. I just did it last week. I just got it last week. It took a long time to get this time.
Okay.
So I just did it. I just did it last week.
Gotcha.
And I didn't feel like I had to do it again this week. Like I can do the 2 weeks. I feel great. Yeah.
I will say this, if you haven't heard me say on one of my recent calls, I used to be 6 months ago, let's use these and let's get off as fast as we can. Now, with the more, and there's a reason for this, there's more and more literature that I continue to see, more and more advancements in our understanding. I am becoming more comfortable with these medications in terms of they're a lot safer. They're being used for all these other indications, less downside. Not saying no downside. I still think the goal needs to be heading towards less dependence. That has less dependence. Now, does less dependence mean we have to completely wean off? I think that would be the most ideal, right? I think everybody in a sense would say if I can maintain health and feel great without the meds, I'll choose that. So I think everybody wants that. But how do we get there? And so and now that I'm leaning in the direction of being more comfortable with them, now we can take our time. Now we don't have to rush. And I think the balance that you're going to be figuring out. And if you stay in our community, I'll be learning with you about your body, and suggesting new things. But what we're ultimately trying to accomplish, whether it's lasting weight loss or in your case, seems to be, how could I feel this way without the med? So we are trying to find the right combination of lifestyle that could fix that issue, so that you need less med. So it's the same concept of
Right.
someone else. Okay, you just lost 50 pounds. Now, how can we maintain that without the meds? Same concept, just in your case, it's a different thing in particular. So that is the thing right there. If you're wanting to do that journey and ride that ride, I think that makes a lot of sense, where we keep trying to play around with different things about your health, the fasting, the weightlifting, the
Yeah.
supplement calls. And there's also a thing that's also just time. Like the longer you maintain this newer and healthier lifestyle, implementing and focusing those pillars that I teach, there is a point where your body continues to heal, and maybe just without you even noticing, the next time you try, because you have to keep trying, like and there's no book to this, right? So every period of time trying to go, okay, so for your situation, you're doing every other week. So let's say you do every other week for the next 3 months and you're feeling good the entire time. Okay, great. And you've really done really good on all the lifestyle. At some point, you need to go, let me try every 2 weeks. And then you try that.
I'm gonna actually try it's longer than 2 weeks, like because I hit my goal pretty quick because I didn't have that much to lose. It was like 15 pounds that I wanted to. So the last month I did start to do the weaning every 2. So now I'm going to try to do that. I have it again. I'm going to try to go 3 weeks. Like I'm going to try to push it as long as I could and work on that to not be dependent on it and wean off of it. But I'm just happy it's my first time that I haven't gained back that 15 pounds.
That's awesome.
It hasn't come back. And it's been 5 months. That it's been 2 months, well, over 2 months. Usually when I get to this weight that I am now, I keep it for maybe 2 weeks and I always start gaining it back. And it's been 2 months more than 2 months that I've been at this weight.
And
it's the longest I've ever held it. Yeah.
And how's everything going as far as like the fasting is obviously the biggest thing that I'm a big advocate of, but the weightlifting, the fasting, which tenets of what I teach do you really have in?
I do the long fasting every day, and I could do, once I hit now 36, I'm finding it hard without it. Or the 24, sometimes I can't go past the 24 and I feel like I have to eat, else I can't go to sleep. Like I'll get really hungry, but that I've never done the 48. When I was losing the weight, it was my first time in my life I ever did 48-hour fast and everything also. So I know, so now it's in my head. It's like anything else. Now you could do it. So I know I could do it. So it's like that.
So the thing that's going to help to improve, like I said, is getting better with the fasting, trying to get to that range. Not every week, because you don't need to lose more weight, but still maybe every 2 weeks, every 3 weeks, trying to get it. So I'd probably do that during your terzepatide week, is do the long fast that week, right? And then continuing to focus on the other pillars and improve those, the stress, the sleep, the supplement, the weight.
Yeah, because you feel the inflammation's gone, you're feeling better. It's not just weight, it's the way you feel. It's inflammation, your body's metabolizing like it's supposed to be. I feel like I'm not holding on to weight in my stomach anymore like I was. I'm menopausal, I'm 50 this year, like everything. And all of a sudden I'm like, oh my God, I feel normal. I haven't felt like that in a really long time. So
that's super awesome to hear.
Yeah.
When you're increasing your duration between each injection, make sure you give yourself time. Meaning, if you're going to do every other week, let's do that for a month or 2.
Okay.
Yeah. Let's be systematic about this. There's no textbook that says how long. Yeah. So if you're going to do 4 weeks, 6 weeks, 8 weeks, let's choose that. Let's go through that whole period of time.
Go for a month of every 2 weeks and then do every 3. Okay.
Yeah, I would. Yeah, I'd probably maybe more like 2 months do that, because we need a few rounds of like actually going back and forth. Then I would say after 2 months, if you're like, okay, I feel good, I think I can do more. I can increase the duration. Then maybe do every 2 weeks for another 2 to 3 months. And then this is where you can interact with us, give us the feedback so we can document and we can continue to learn.
Okay.
I think that's the next plan. And if you ever hit a roadblock where you notice, okay, I was fine on every other week, and as soon as I went to every 3rd week, that's where I lost control, and it seemed like then you take a step back and go, okay, great, let me go back to every other week. And then now I know, what can I change and improve more? Run that in my physical, like my lifestyle, run that for 2 more months, and then go back and test again. See how we back and forth? All we're doing is experimenting with our body. and seeing
Yeah.
has it progressed and then going back if it hasn't. That's it.
It feels so nice though too, also to be in control of that, because you're just looking, everything that you see online, even diets or anything is always not for you. It's just the standard of what works, what's supposed to work. And now you're actually doing something else that's just for you. That not everything works for everybody. I can't eat 6 meals a day. I always gain, no matter what they are, I gain weight on that. That was always too much for me. And things like that. Like I just never lost weight on that diet that I was ingrained, or Weight Watchers, counting points. And I always had a carb, and I'm not even insulin resistant, but I don't metabolize bread. I know that. I just don't. I feel like even when I was doing keto, I never was in keto for very high, like high numbers. I did all the blood, and I would always be like, I don't understand why. I just my sugar levels always did not go, were always elevated.
Gotcha.
Yeah.
Gotcha. Okay.
So
Fantastic. I think we have a solid plan moving forward. Do you have any questions for yourself?
no, I was just wondering about the BPC 157. I really feel good on it. So that's 60 days. That's for digestion and the
You can get any duration you want, but BPC 157 helps for gut, and then it also helps
right.
systemic, like musculoskeletal achiness
Yeah.
and degenerative issues.
Oh, okay. Yeah.
So
Okay.
yeah,
No, that was, yeah. Good.
cool, fantastic. All right, Lori. So
Okay.
same question for you. Where are we at on our trajectory towards our goal?
Technically, I've reached my goal weight, but it's
Fantastic.
not exactly my goal weight because it'd been such a long time that I've been at this weight that I didn't know really what my goal weight was. So I think with my age, since I'm 68, I don't have as much muscle mass as I had before at this weight. I'm doing the resistance and that, but it's only been the last month and a half or so that I've really been working at the resistance as well as I should have. But I'm at the point where this was a financial decision for me because of health problems with my husband and everything like that. So I'm I'm still planning on continuing with the diet part of it, but I've still got a few doses left that I'm going to wean down on
Yeah.
that, and then do the fasting and continue with the fasting. As I say, I haven't made it 48. I think 36 to 40 is pretty much what I've been getting each week. So we'll see how it goes with this. Hopefully it'll continue to come off. It's about 1.5 to 2 pounds a week. It's been going well. I feel great. I'm a little worried about coming off of it because every time I've done a diet, I've gained it right back and plus more. And hopefully this time I've thrown away all my big size clothes because I'm not going to do that this time. So
I'll tell you what, like many other, and you probably heard me say this, with many other programs, they don't do post-weight maintenance coaching because they're all terrified everyone's going to gain their weight back, as they should, because most people do. When that's not how I feel, because I feel very confident in my program. And I think if with what you're sharing, finances are definitely coming into play here. The most, in my opinion, especially if you're already at your goal weight, I think at this point, really, it's just making sure you're doing the right things and still having support and communities. How we doing? Same question for you.
Doing well. I'll say I'm trying to not focus on the number as much, just because if I'm looking at the number I was looking at, I've still got about 15 or so pounds to go. But I'm finding, I think we've talked about my vertigo issues and things. So I have a follow-up with an ENT this coming week and looking at that to help with my resistance training. So for me, that's my focus right now, is trying to up my resistance training. But I'm still losing about 1% a week, 1% to 2% a week. So
great. Yeah, that's great. That's great. Especially now, if you're starting to lift, navigating around what you can and can't do. That's really good, because now you're losing less muscle mass. So that means more of that weight we're losing is fat mass, which is exactly what we want. Yeah, I'm looking at your weights right now. So yeah, last one was 159. That's great. Yeah, you're kicking butt. Super cool. Any specific questions on what your thoughts are moving forward and where to go next?
I was thinking I had already extended, but I may not have. I know we talked about, because on your program I'm on the AOD, and then I got another round of AOD, and then
And
I had asked, go ahead.
Yeah, that includes coaching. So that just to be clear, that does include a couple months of coaching with it.
Okay. But I know I did ask about, I think, the LDL, and then I'll say for me, I'm 51, turning 52 this year, and I've never had wrinkles. And now with the weight loss, I'm starting. So that's been a big concern of mine, is like loose skin and such. I'd also asked, I think, about the cream you guys had recommended. So those were a couple things they told me to ask you about.
Yeah, the GHK copper cream is awesome, and it's a peptide that they compound into a cream, and it's very it's very popular in the anti-aging space, and proliferates stem cell regeneration to the skin, tightening, elasticity, things of that nature. The reality, and I never want to overpromise and underdeliver. Loose skin is loose skin. That's one of the toughest things. I would never sell somebody GHK telling them it's going to tighten all their skin. No, it's the most potent cream we have. And truthfully, if you're going to make that investment, I would do a full-blown skincare routine. And in a skincare routine, you maybe already doing some of the right things, but is not as expensive as people think it can be really expensive, but it doesn't have to be. Having a good retinol cream, make sure you're cleansing, throw in a vitamin C in the morning. You get all those pieces in together with the GH copper. Now we got a more potent, instead of just doing the copper and that's it.
Yeah.
I'm actually going to be putting out some videos on skincare here soon in a little bit on all the bases of it, but plenty of great videos on YouTube. Like a ton of them. But yeah, I think that's the best bet in fasting, staying hydrated, consuming collagen, peptides, things like that are probably your best bet. So for tightening skin.
Okay.
Hormone therapy is another thing that comes to mind too, as well as having the potential to help skin, keeping your sex hormones, specifically testosterone, optimized, but estrogen, progesterone plays a role too as well. That's probably another path. And growth hormone too as well plays its own. So you have growth hormone peptides. So you do a couple different advanced therapies, but I would say the GHK copper with the skincare routine is probably a starting point. And then the other areas, if you want to double dip with some of their own benefits, like BHRT covers a lot of other things besides just skin. So does growth hormone too as well. So.
Well, I know I traveled all last week, so I didn't get my blood work done, but I'm working on getting my blood work to do the follow-up, because I'm on the program for the thyroid
Good.
care. So I was going to do that and then look at, like you said, at the hormone therapy and so I'm assuming the nurse practitioner talked through some of that.
Yes. So I can just talk about how the mechanics of that work. So when you're in a FLOA Warrior coaching program, which is what you have extended recently, that comes with the free thyroid management. You just pay for the prescriptions. If you didn't extend Warrior coaching, wanted to keep thyroid, we have a thyroid only program. But the thyroid only program compared to the BHRT is not much of a big, so you get much more value if you're going to do BHRT because that comes with thyroid. So if you're already thinking that, basically you just let us know and we'll get you scheduled with the right person to get you signed up for that. But
okay.
So at this point, continuing thyroid after your coaching ends, it would be one or the other, thyroid only or both. And I'm a big fan. We've been doing hormones for 10 years. And even just the testosterone piece of it is huge. But also if you are starting to get some of those menopausal symptoms, night sweats, hot flashes, like
all the above.
Yeah. And it's such a damn shame that women have been told for so long that this is not the right path and that it's dangerous. And I think we're finally starting to open up our eyes. I don't know if you guys have seen this, but there's a lot of menopausal doctors finally coming out, and people are getting comfortable saying, no, we should have been on hormones the whole time. It's crazy. But we've been doing it for 10 years, and it's been amazing because as a woman, you really can't fix those issues other than toughing it out for years, which is unbearable, or getting some natural hormones to replace what's been depleting.